The reality is, this virus has taken a massive toll on all of us. The huge strain on families, seniors who can't have their loved ones visit them right now. The economic fallout, countless people losing their jobs, struggling right now. And I know how hard it is for everyone isolating at home. But this period has been hardest for our essential workers. They're getting up every day. They're leaving their families and children behind. And getting to work, I know that's not easy. And I know it's causing anxiety for them and their loved ones. But I want you to know that Ontario recognizes your sacrifice. And I want you to know, I want our dedicated men and women on the front lines to know that Ontario has your back. You have an army of 14.5 million people behind you, from every person isolating at home to the incredible companies stepping up, retooling to get supplies to the front lines. And yesterday, we put out another call to action. We called Ontario for more boots on the ground, reinforcements for our healthcare workers. We launched a system to connect people with healthcare skills to healthcare jobs that desperately need to be filled. And the response has been absolutely incredible. As of today, we've seen nearly 8,000 individuals sign up. And there are already 1,000 people matched to potential jobs. We're going to deploy those workers as soon as possible, filling vacancies in the healthcare system all across Ontario. And now we're making sure we have the necessary infrastructure, we have the beds we need. That's why today we're accelerating critical construction projects in our healthcare sector. We're extending the hours of construction to help get these projects built faster, to help get hospitals built faster, to get more beds and more capacity built in the system. That includes assessment centers and temporary structures needed to prepare for any surge in COVID-19 cases. We have to be ready for any scenario, and the health and safety of our essential workers is always top of mind during this pandemic. That's why we're introducing new measures today to keep essential workers across Ontario safe and healthy. Whether you work in a grocery store or on a construction site, we're looking out for you. We're redeploying inspectors to ramp up investigations. We're issuing a call to all retired inspectors to join the fight against COVID-19 and help keep employees safe and healthy during these uncertain times. I'll let Minister McNaughton speak more to these important measures in a moment. But first, with a long weekend ahead of us, I have an important message for our essential workers. We've been listening to business owners and employees. The truth is that everyone working in our grocery stores and pharmacies, our truck drivers, and those working the line, they've been working day and night for weeks to keep the food and medicine we need on the shelves. And one way we're saying thank you is making sure they have this Friday and Sunday off. They deserve a break and some quality time with their families. Stores will be open Thursday, Saturday, and of course, again, Monday onwards. Let's give our workers a break they've earned. Today, we're also saying thank you to our truck drivers. Truckers can pick up a free coffee today on us at any en route location. Thank you to all our heroes out there, our healthcare workers, our essential workers, all the caregivers and truck drivers. You're incredible. We owe you everything. Thank you, and God bless the people of Ontario.
Well, thank you. The health and safety of workers is always a top priority of this government. Never has there been a time when that's more important. There's a lot of hardship out there and a lot of fear. but I also see a lot of gratitude. Gratitude for the people who are going about their jobs so that all of us can get through this. The call center workers, the healthcare workers, the grocery store clerks, the pharmacists, the builders and tradespeople, and of course, the truckers. I could list hundreds more. These workers are performing vital services. They're helping us get by in very trying times. Families across Ontario bang their pots and pans for them every night at 7:30. My family has put a blue ribbon on the tree outside our house. They're unsung heroes. Well, if you're one of the unsung heroes that's going about your work in an essential business, I want you to know this. Our government is doing everything in its power to keep you safe during this pandemic. That means more inspectors, more inspections, more phone lines, and more people to take calls. No stone is being left unturned. And that's why I want to add another job to the list of unsung heroes, the workplace inspectors. These women and men performed nearly 5,000 inspections last month, and they're doing thousands more now. I talked to Kevin, Peter, and a couple other inspectors recently. They told me they were honored to be playing their role during these trying times. This is truly public service. Our inspectors are going into places to investigate problems, places where workers think they're in danger. They're sorting those problems out, working with employers and employees and encouraging parties to work together. Where warranted, they're shutting workplaces down. They are the ones following up on complaints to our phone line. That phone line is 877-202-0008, where any worker in Ontario can call to express their concerns. Today, I'm announcing a number of advances in our mission to keep workers safe on the job. First, we've extended invitations to recently retired inspectors to come back on the job. Second, we're redeploying more than 30 employment standards officers to help businesses understand and comply with health and safety requirements. Third, we're deploying another 30 specialists from various health and safety associations to support employers and workers in the field. Fourth, we're issuing more health and safety guidance notes to support specific sectors. And finally, we're doubling the capacity of Ontario's Health and Safety Call Centre to 50 lines from its current capacity of 25. The total result of the 5 action items I've announced today will be more inspections, more capacity for workers to voice concerns, and more capacity to follow up on those reports. If you're a worker in Ontario, I want to tell you I appreciate your service, and so do the millions of people who you are helping. Thank you. If you ever feel unsafe doing your job, call 877-202-0008. Our government is working day and night to support you. We will leave no stone unturned when it comes to keeping workers healthy and safe across the province. Thank you.
Well, thank you, Minister. Ivana, before we start the questions, I want to address a couple things that have been on my mind for the last little while. There's 2 things that I'm zoned in on. One, the PPE items that, again, we're working day and night, and I do see a little bit of light at the end of the tunnel, but we need to continue to work hard. Number 2, that I haven't been involved in, and I've been pretty transparent right from the beginning, I rely on our health experts to give myself, give my Deputy Premier and Minister of Health, Christine Elliott, advice. And we have a great deal of respect for the health professionals. We have some of the best health minds anywhere in the world sitting at our COVID command table. What is concerning me, and I've been on the phone last night with the CEO of Ontario Health, Matt Anderson. I was on the command table today. What is unacceptable, absolutely unacceptable, are the numbers of testing that we're doing. I may not understand health, but what people understand around this province and what I understand are numbers. And we also understand countries that have tested and ramped up testing has shown results. As I mentioned to our command table and to the CEO last night, you know, my patience have run thin, and no more excuses. It's unacceptable. We have the capacity now. Before, I understand, we didn't have the reagent. We didn't have all the testing. We have the testing capabilities. We have the assessment centers capabilities. We have the reagent. We say we can do 13,000 a day. Then we need to start doing 13,000 every single day. I want to see every single long-term care facility tested, every patient. I want to see the healthcare workers tested at the long-term care, along with senior residents. I want to see every frontline healthcare worker in this province tested, along with the first responders, our police, our fire, our paramedics. We owe it to them, along with other people being tested. The days are done of these 2,000 and 3,000 a day being tested. And moving forward, we need to see 13,000 tests every single day. I have the confidence of our health team. I have the confidence of our leadership at the table. We have to make this happen. And we need to start doing it immediately, starting tomorrow. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Colin DeMello from CTV News. Please go ahead.
Hi, Premier. So a lot of the questions you're probably going to be getting today is about testing, and I just wanted to kick it off by asking you, so do you feel as though right now, the command table, yourself, your health minister, do you guys have an accurate view of just how far COVID-19 is actually spread across Ontario?
Well, I go back, Colin, and first of all, I want to tell you something. I have the best deputy premier and the best minister of health I could ever ask for. And Christine's just been working her back off all day and all night, and I'm just so grateful for her leadership and partnership with myself and the rest of our team to get a full scale. It's common sense. The more people you test, the better the numbers are going to be. And again, it's unacceptable. There's no more excuses why we're testing 3,000 a day or a little over 3,000. We need to see 13,000 people tested every single day moving forward. Colin, it hurts me coming out here every day and seeing the incredible job my Deputy Premier and Minister of Health is doing, and constantly under fire. Well, those days are done. We're going to move forward on a rapid fashion to make sure every single person possible can get tested, and we need to start making sure that we test the frontline healthcare workers, test the long-term care as a priority, because that's where we're seeing it spread fastest. But that's the least thing we could do with the sacrifices these frontline men and women are doing for our province and for our country. We need to support them, and I'm giving you my word, the support is coming.
Premier, I mean, we've known about COVID-19 since, the middle of January in this province when we first had the first case, and testing has slowly ramped up since then. Why has it taken roughly 3 months for this to come to your attention? I mean, you've been taking this bull by the horns approach, but why is it taking you so long for this to come to your immediate attention and to your front burner personally?
Well, again, I rely on our healthcare team, and make no mistake about it. We have an incredible health team. We have the brightest doctors, I say, in the world, and I'll stand by that day in and day out. If it wasn't enough assessment centers, and then we didn't have enough testing, and then we needed more reagent, they're done now. We have that. So we need to move on this, and we need to move immediately. And as I've always said, Colin, I've been very clear with the public. I've stayed out of the way of the healthcare professionals, and I'm going to continue staying out of the way. But when it comes to testing and the numbers, Colin, you understand numbers. The 14.5 million people in this province understand numbers, and we know one thing. When you increase testing, you're going to get better results on making sure we're measuring the people of Ontario, who has COVID, who doesn't, what areas we see the spikes in. So we're going to get a move on it, and thank you, Colin.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Premier. So to your point, if we've been getting around 3,000 tests done a day, and we want to see 13,000 tests a day starting tomorrow, so 10,000 increase, what happens if these tests aren't done? Is there going to be some sort of retribution from the government on healthcare workers or doctors, or what's the punishment if they don't get the test?
Well, Robert, I just don't believe in threatening. I just don't believe in it. We're asking for their help. I'm saying I want, the people want, and it's up to them to execute it. And they will. They'll get the job done. And again, it's unacceptable. I'm first to admit it. And we're relying on our health expertise and experts around that table. They understand health better than any of us. And I just want them to make sure that we increase the testing. I've made myself loud and clear to the table. I've made myself loud and clear to the CEO of Ontario Health, and we're going to get it done. I'm going to be on this like a dog on a bone right now because we have to. We have to, for the sake of our frontline healthcare workers, to protect them, give them a little bit of ease of mind that they know they've been tested. And I understand after being tested, being in that position, you can go out after being tested and 2 days later still get COVID-19. But it's better being tested than not being tested. And we need to start testing everyone possible. After our frontline healthcare workers and first responders, we need to start testing everyone. Simultaneously, as we're testing the frontline healthcare workers, we need to continue testing people. And we have the assessment sites ready. We have the testing capabilities right now. And we have the reagent. So there's no more excuses. We need to get it done, bottom line.
And on a related subject, I know you said that the other thing that's been concerning you is the personal protective equipment case. The Prime Minister says that 500,000 of those 3M masks are arriving in Canada. Is Ontario going to get 40%? Its share by population of those masks?
Well, I'm really hoping so. My last call was about 11:40 p.m. last night with the Deputy Prime Minister. Deputy Prime Minister is doing an incredible job. So is the Prime Minister. But we need our 40%. We're 40% of the population. That's what we need. But we're there to support and work collaboratively with the federal government. But we can't just rely on the federal government. We're out there sourcing all around the world, and we have a lot of hooks in the water right now, all over the place. And we're confident. I'm a lot more confident now, today, and yesterday than I was a couple days ago. Again, we're seeing some light at the end of the tunnel, but that doesn't mean to sit back on our laurels. We have a team out there reaching out and making sure that we contact as many people as possible. There's thousands of people offering, and you have to decipher. Some are real, some aren't real too. So we have to make sure that when this equipment comes in, the N95s, they get tested, they get properly tested. We send them over to UHN to get tested as well, Health Canada, and SGS to make sure they're certified in their real N95 masks. There's a lot of fraud going on out there around the world, and we have to make sure that when we purchase these items and this protective equipment, it's real. I have another great story about the gowns, surgical gowns. So there's a few companies out there that are ramping up to do the surgical gowns. So everything is ramping up and coming together now on the PPE side of things. But the PPE is one thing, but being tested is another. And we have to focus on making sure, as we're working on PPE items, that simultaneously we're doing testing.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Premier.
Hi, Cynthia.
Not only have we had so few tests done in this province, we're also the lowest per capita of any province in this country. You've been asked about this many times by myself and other reporters over the last few days and weeks. Where has the failing been? Why has Ontario had the lowest rate in the country? What has the failure things?
Well, what the barrier was prior was the reagent. Again, Cynthia, I'm not going to look in the past. We're going to learn from the past mistakes, and we're going to move forward. And I know moving forward, that testing is going to be ramped up. Again, no more excuses. It's unacceptable. I agree with you 100%. I could give you every excuse under the book why it wasn't happening, be it the testing capabilities or the assessment centers or not having enough reagent. I'm done with that. I'm done. We have everything in place. No more excuses. And as you can see, I'm a little frustrated. And I'm not frustrated per se with the people, because we have great people. And I want to emphasize that to the public. We have a great health team, but we have to get moving on this immediately. Immediately.
But Premier, to follow up on that, every province had the same challenge of getting reagents and setting up assessment clinics. We're the ones who have come out on the bottom there. How is that possible?
Well, I've been following the advice from our chief medical officer. I've been taking that. I think he's been doing a great job, but we need to increase testing. Again, I could run through a million excuses. Why? I don't believe in excuses. Let's come up with solutions, not excuses, but solutions. And what are we going to do moving forward? Well, we're going to make sure more people are being tested, and I'm confident when we come in here day after day, we're going to see results, and we're going to make sure we see results.
Next question.
Next question comes from Travis Zenrush of Global News. Please go ahead.
Hey there, Premier.
Hi, Travis.
First question is on the testing, as you would expect. So when you spoke to the
I'm sorry, Travis, could you repeat that first part again?
Yeah, it's on testing. Can you hear me?
Yeah.
Right, okay. So when you spoke to the command table, what was their reaction? And did they say, you said that you want 13,000 tests starting tomorrow. You want every single frontline healthcare worker tested and every single long-term care worker tested. Did they say, yes, Premier, this is going to be feasible starting this week? And just tell us a little bit more about how that conversation went and what they said to you in response to your concerns.
Well, what I heard was, yes, we're going to get it done. And we have a relatively new CEO at Ontario Health, which I have a great deal of respect for. He's a very, very bright individual, and he gets frustrated at times too, like all of us. You know something? I believe in Dale Carnegie. He apologized, and he said it's not going to happen again, and this is what we're going to do to correct it. He has a plan, and he's going to get the testing done. I respect that. I respect that someone realizes it hasn't gone down the right road, and we're going to make it happen. Again, we could sit here when we talk about a government the size of Ontario and give you every reason. I don't believe in that. I believe in let's get this moving, move forward, learn by our mistakes, and make sure this doesn't happen again. And I have all the confidence in the world in Matt Anderson over at Ontario Health. He's going to get it done.
So I have a question for you on cottage country, but just to follow up on that, so are you saying you're confident 13,000 tests will start as of tomorrow?
Well, I'm not going to quantify exactly the numbers, but what I am saying is 3,000 tests or a little over 3,000 tests are totally unacceptable. We have the capabilities of 13,000 tests a day, and there's no more excuses why we shouldn't be getting 13,000 a day. That's going to be our goal. I'll be following up with our team later today and make sure that the plan is very clear. Start testing the frontline folks at long-term care, test the residents, and test the seniors and seniors' homes, and make sure we test all frontline healthcare workers, and along with making sure we test our police officers, our firefighters, our paramedics. And it's critical we take care of these people. Simultaneously, we have to continue testing the public as well. It's all hands on deck right now. And test, and don't stop testing. So let's see over the next few days. I'll be here every day moving forward, and let's take a look at the numbers. I'm confident that we're going to go in the right direction. On your second question about cottage country, I just had a message from Norm Miller, representative up in the Muskoka area, specifically Huntsville, Bracebridge, along with many, many mayors and many, many wardens I've talked to. They're begging us to get the message out. Please, this long weekend, do not go to your cottage. We can't stress it enough. And you know, there's no one, Travis, that loves the cottage more than I do, but I'm not going to my cottage. We're going to make sure that we listen to the protocol that the chief medical officer has requested, and especially the people up there. You know how nice the people are and so salt of the earth up in cottage country, but they have to take care of their families and the health crisis. You know, they don't have as many acute care beds as we do here in large urban centers. And when you know, 50,000, 100,000 people start heading up north, they'll clean the shelves off in the grocery stores, and we all know the lineups are long enough right now. We don't want to put that burden on people up in the cottage country. So please, just stay at home.
Next question.
Next question comes from Allison Jones of the Canadian Press. Please go ahead.
Hi, Premier. Still on testing. You've said that, you know, at first the issue was that there weren't enough assessment centers, then we had to ramp up lab capacity, and there wasn't enough reagent.
Yep.
What's your understanding, based on the discussions you've had with the people in the health system, of what the issue still was? Because those problems have been solved, is
Yep.
my understanding, for a little while now. What is your understanding of why we were still having this issue of such a large testing gap?
Well, just really over the last probably 4 or 5 days, we're able to restock the reagent. But again, Allison, we could sit here and I could give you a list all day long what I hear from our team, but we have to move forward. We have to move forward and learn from our mistakes in the past. And again, I rely, and I'll continue to rely on our experts on the health table. But I understand, and Allison, you understand, and every Ontarian understands. They understand numbers. They understand when they read in the newspaper that South Korea, you know, slowed the spread and flattened the curve by doing one thing. I'm sure many things, but one thing stood out to all of us. They tested and they tested and they tested. Same with Germany. They tested and tested and tested. Well, we're going to continue testing, but we're going to ramp it up and we're going to surge the system.
And you've said that in addition to testing long-term care residents and as many frontline workers as possible, you want to ramp up testing as well for ordinary citizens.
Yes.
Do you know how that's going to be accomplished? Are we going to be expanding the criteria?
Well, again, I think I should pass this over to my Minister of Health.
Well, we are working with priority populations. You're absolutely right, working with people who are in long-term care homes, retirement homes, other places where there's congregate living. We want to make sure that when people present at hospital, that the doctors, nurses, whoever sees the person there, if they feel that they might be part of a cluster, that they're showing signs of COVID-19 or may well exhibit them given their living circumstances, that they will be tested as well. And of course, we want to work with our Indigenous communities too. We have had one community that has had someone who has COVID-19. So we are working with the federal government to make sure that they receive the necessary supplies that they need, because in small communities, in some of the remote communities there, we know that they need special precautions, and we need to do more testing there, as well as with our first responders. So there's a number of groups of people that we have identified that do need to be tested. That we are, as the Premier said, we're significantly ramping up the testing. We do have a plan, and the plan will be released to you in detail very shortly, but there is a plan that we are in the process of implementing right now.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Hi, Premier and Minister. I'm wondering if Well, actually, I'm wondering why the criteria for people being tested at the assessment centers has not been broadened more quickly. We're hearing loads of stories of people who are being turned away from the assessment centers or being discouraged from going for testing, even though they have symptoms. So I guess what I'm asking, although you're focusing on the priority cases, what are you going to do to ramp up to that full capacity in the way of giving some sort of direction to the health sector that just people who have symptoms and who haven't traveled, maybe they ought to be tested?
Well, again, Mike, there's no excuse. We're going to do this simultaneously. They have a plan. They're moving forward on the plan, and I'll pass this over to Minister of Health.
We are moving forward with the plan, as the Premier has indicated, and the criteria has changed slightly for healthcare professionals. So it's the common symptoms that we've already discussed for COVID-19, but they have been expanded to include other categories that may be suggestive that there is a COVID-19 case. And that is something that we are leaving to our frontline professionals at the assessment centers, to the physicians that are working there, to the nurses that are working there, to be able to use their clinical judgment to determine whether the test should be administered. And that will be another way that we will be able to expand our capacity very quickly to include 13, 14, 15,000 cases per day in our testing.
Okay, then my follow-up maybe is a little clearer. Why are so many people who have symptoms of COVID-19 being turned away, rejected at the assessment centers, being told that they can't be tested?
Well, part of the reason was, as the Premier indicated, that we didn't have the reagent, the testing solution, in order to be able to process the swabs to determine if people had COVID-19 or not. We do have that reagent now, so we do have the test kits that we need. So now we are able to ramp up our testing. We are able to expand the assessment of people that will be tested, and we are going to implement that plan right away, because we know that testing is so important, as it was in South Korea and other places. We need to get our numbers up, and we're in the process of doing that right now.
Next question.
Next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, Premier. Does Ontario have enough kits to conduct the level of testing that you're describing, or will the province find itself in a tough spot running low on tests in a couple of weeks? How long can the province actually sustain 13,000 tests a day?
Well, we're going to continue testing that amount. I've been told that we have enough reagent and test kits to continue on testing at a rate of 13,000. And keep in mind, as every day passes, we're getting more reagent, we're getting more test approved from Health Canada. I've been talking about the Spartan test that we can get results in an hour. I know Health Canada asked Spartan to clarify a few items, which they're doing, so hopefully we'll have that. That alone, we have over 900,000 test kits. So we'll be able to test quite a few people, along with new test kits coming in, as one came in today that we've sent off to Health Canada. So I understand there's enough supply out there for the kits and reagent. I had that conversation last night with the Deputy Prime Minister. She said, Doug, anything you need to increase the testing, we're there for you. And I just want to thank her again for all her support and the great job that they're doing at the federal level.
And my follow-up question, the gap in testing, was it a lack of resources to actually do the testing, or was Ontario Health stockpiling tests for upcoming waves?
No, they didn't have the reagent. You know, we were out there hunting the reagent everywhere we could. We now have a good supply of reagent, and we're able to do the test. Like all the ducks are in a row right now. No more excuses, as I say. Let's get the job done. Let's move forward and test as many people as possible. And we're going to hold everyone. There's accountability at the end of the day. The buck stops here. I'm accountable, and I have no problem being held accountable. But we're going to make sure that these tests are done. I'll be up here every single day, and I can assure you, I'll be looking at those numbers every single morning. When I get up, the first thing I'm going to ask for, how many people we tested.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Mr. Premier.
Hi.
Some doctors have been asking their local public health officials to test long-term care residents who are coming into the facilities, and they're actually being rejected. The public health is refusing to pick up these tests. What do you make of that, and are you now guaranteeing that every single long-term care resident entering a home will be tested for COVID-19?
That's what I've asked our command table. That's what I've asked the CEO, and I know that the Minister of Health agrees we need to test these long-term care workers and the patients. We need to pick up the testing right across the board, especially for the most vulnerable people in society, where we're seeing the most people with COVID-19, and unfortunately, the most deaths are at these long-term care, and we need to test them. Everyone needs to be tested. I've always said, Laura, and I've always admitted, I'll say it again, I'm not a health expert at all. I rely on our health experts, but one thing we all understand are those numbers. The more we test, the better we'll be. So we'll get onto it. We're all over this right now.
So just to clarify, is the policy actually going to be formally changed today? And just to pick up on what you told Haley, you said there's accountability. So is anyone going to get fired over these poor testing numbers?
Well, again, I just don't believe in putting these threats out there. I know they're great people. They all have their expertise. They're all working hard, and no one's sitting back, putting their feet up. No one is. They're all working hard. But we have to make sure we have the reagent, we have the testing capabilities. Let's start testing. And I know that just happened over the last few days. Everything's come together, but we need to get it tested. So we're going to look at the results every single day. But again, Laura, I have confidence in our team. They know the direction we need to go in.
Okay, this will be the last question.
The last question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Premier.
Hi, Randy.
We've been talking to greenhouse operators today,
yes.
And normally Easter is a large part of their business, and they're in a position now where nobody's buying flowers, and if they don't sell the flowers, they can't move on to their next crop, and frankly, some of the operators are apoplectic because they're going to have to compost millions of dollars worth of product. Is there anything that your government can do to try and prop up this industry?
I know it's all timing. You know something, Randy? I've walked through those greenhouses all through the Niagara region. These are family-run farms. The people are out there. They have their kids out there. I've met families that run it. My heart breaks for them, like so many other companies. But we'll make sure that we talk to the Minister of Agriculture and see if there's anything we can do, and talk to the local MPP as well, Sam Oosterhoff.
Okay, and Ms. Elliott, if I could return to what I was asking you yesterday about prescriptions being given out a month at a time. Other provinces have implemented the same thing, but some of them are compensating patients for the dispensing fees for the second and third prescription that they would normally get all in one dispensing. Is there any thought given to doing that?
Well, first of all, we agree that because of the change that we have recommended that only 30-day increments of medications be dispensed at a time to make sure that there's a supply for everyone, that it is putting people and communities at greater financial cost. So we are looking at a range of alternatives, including compensating the people themselves or compensating the pharmacists for the changes. We will be coming forward with an announcement in that respect very shortly.
Okay, thank you.
Okay, thank you, everyone. Thank you.